Hey everyone, happy Tuesday. So today we're getting real close to open enrollment. I know many of you are thinking about what to do, what changes need to be made, whether you're doing open enrollment through your employer or you're on your own for insurance. Something that's really important to consider right now is understanding your insurance and knowing what your needs are. So something I try to educate people on all the time is you have to learn the basic stuff about what your insurance does so you know how to use it properly. Most people think they get this insurance card and it's magic. They just go to the doctor or go to the hospital and hand them their card, and then they're shocked when they get a big bill. Well, that's another subject we're going to talk about in a second about big billing. But the first part is to understand who's in network with your insurance. Do they have out-of-network benefits? Where in town can you go to get your treatment? Are there places that charge more than others? So shocking, yes, that's true. You could check with 3 different hospitals and they're all going to charge 3 different prices for the same exact procedure or surgery or test or whatever you're having done. And why is that? Well, that's because we do not have transparency in our healthcare system. So you're going to get me on my soapbox here. So what I joke with everyone is, if you're in the market to buy a big screen TV, do you walk into Best Buy and hand them your credit card, just like you would hand the hospital your insurance card, and go, pick one out for me? Just put it on my card. Nobody does that. Nobody. And what do? You look at the prices on everything in Best Buy. You may even go to Costco and see how much that TV is there. And maybe check Walmart or Target. Guess what? You're going to shop and you're going to look to find the best price because it's your money. Well, it's true for healthcare too. It is your money that you're spending. Whether you're sending a ton of money in for premium, then you dang sure better get a policy that's going to pay something if you need it to. If not, then why are you paying a whole lot of money for premium? Because that just doesn't make any sense. Wouldn't it be great if hospitals and medical places had to post their pricing online? Think about that. Think about how, if we make healthcare more consumer driven, how that would change how the whole healthcare system works and what you're charged. Because those prices they charge in hospitals are not real prices. So for example, I have recently had a client that had a knee replacement done up in big name hospital, private hospital in Dallas, Texas. The hospital had them pay $3,000 up front to cover their deductible. And then insurance paid, and they paid several $1,000s. And then client got a bill for, get this, $174,000 for a knee replacement, which is already more than 3 times what the average cost is completely. Ooh, patient was upset because they get this large bill. So I tell them, well, the provider you used was not in network. Did you call me before you had this surgery? No. Did you ask the hospital if they were in network when you went? No, I just handed them my card. Okay, well now we'll deal with this on the back end. So what did I have this client do? I had them call the hospital and say, guess what? You never told me I was out of network. You need to reprice my bill for cash price. Of course, they didn't want to do that and, made excuses. Client called every other day. Finally, about 2 weeks later, she gets a bill and she sends it to me and says, is this right? So the first bill she got was $174,000 after insurance and after her $3,000 that she paid up front. They priced that $174,000 bill, her final bill was $1,500. Really? Really? So why do they have to charge you $100 for a Tylenol, $50 for a box of Kleenex? It's a joke. And it's because no one is holding them accountable to how they do billing. So insurance companies need to help with this. You as a consumer can do a whole lot to prevent you from getting stuck with a big bill. And you have to do your homework. Just like you would if you're going to buy a big screen TV, you need to do your homework. You can, as a patient, demand to pay cash. You do not have to use your insurance. But if you don't use your insurance, you may not get any reimbursement. But again, it kind of depends what policy you have. If you have a big name insurance company and your premium is $900 a month and you have an $8,000 deductible, and then it only pays 80% after that, you're going to be on the hook for a lot of money unless you hit a deductible. So if you needed a procedure, I'll give you an example, MRI. If you need an MRI, I don't know, depends where you go, but let's say $2,000. Well, guess what? That all goes to your deductible. And now you get a bill from the MRI place for probably at least $1,500. There'll be an adjustment if it's in network. If not, so you're going to get a bill for $1,500 to $2,000. Well, guess what? There's a cash price place here in Austin that you can go get an MRI for $500. So why would you use your insurance? Well, I pay a lot of money for my insurance. Okay, great. How much more do you want to pay? And that's what people don't seem to understand about healthcare is there's really not a bunch of good options out there if you don't have an employer plan. Even some of those plans are not very good. But the whole key is if we as consumers would do a little homework, we could help drive healthcare costs down because we're going to start refusing to pay all these high prices, ridiculous fees that they charge. I've always joked and bring my own Tylenol to the hospital to be hospitalized because I don't want you charging me, the $100 for the Tylenol. But there's ways. I really feel like, there's actually some doctors starting to do this. There's some concierge doctors that list their prices online. There's actually a surgery center in Oklahoma City that, interestingly, these doctors, I'll have to look up his name to be able to tell you his name, but these doctors left. They had privileges at a hospital. A group of them got together and they decided to open their own surgery center instead of working through the hospital. So they don't take insurance. It's cash price only, but you can go on their website. It's Oklahoma Surgery Centers, and you can see how much it costs for different things. So if it's a knee replacement, a gallbladder surgery, or whatever it is you need done, that's your price. That is all you will pay. They don't file insurance, so unless you have an insurance that will reimburse you, then maybe you don't want to do that, but guess what? You may want to do that because it's going to save you a ton of money. And there's definitely some private plans out there that you can get that will reimburse you if you go to a surgery center and have that done. And this is the kicker. The doctors are making the same salaries they were making at the big name hospital they were at. Yeah. So makes you wonder if these hospitals are charging these ridiculous fees, who's getting that money? Because some people will pay it. Some people will go into debt, will pay it. I know some hospitals don't want to negotiate, and they turn you into collections and do all those nasty things to you. But there's ways to not pay a big bill. There's ways to make them work with you. Because what they charge, they just make stuff up. They just make a fee up. And if they knew they had to put their pricing online, how much different would it be? How much different would it be if even here in Austin, you have choices of St. David's, Seton, Baylor Scott White. If they all had prices and your doctor was in network with all these or had privileges at all these hospitals, and if one hospital charges $50,000, another hospital charges $20,000, and another hospital charges $30,000. for your knee replacement that you need done. Where are you going to go have that done? You're going to go have it done at the place that charges $20,000 because you still have your doctor. It's the same procedure. So I encourage everyone, this is what I do with clients. I sit with them, I consult with them, compare what they have, ask them about their needs to find out what do they actually need in insurance. Do they want something in case something really bad happens? Or do they have ongoing chronic issues that they do need help with, that they do take certain medications, that they need to make sure they have a plan that pays for that? Or does it make sense for them to have a plan that will reimburse them if they go out of network, or pay less in premium and have some limits on certain benefits that they may not be using? I mean, I can speak for me personally. I have a private plan and I'm saving $7,200 a year in premium. Is my preventive covered at 100%? No. I pay a little bit, but guess what? I'm saving $7,200 a year. I don't do that much in preventive care. I do mine once a year and that's it. I'm good. So, and if something bad happens, I have coverage. And again, I know the tricks because I am not going to pay a $174,000 hospital bill. I'm just not. I fought with the local lab here over $120 for 15 months because it was covered by Medicare. They billed it incorrectly and I refused to pay it. So, tricks and trades. I did a great podcast with So Live that is on my will be on my webpage in my blog section, but right now it's on my Facebook page, JCAP Consulting on Facebook. You can go to my website, jcapconsulting.com. If you want to evaluate your insurance needs, you can schedule a consultation with me, a 30-minute free consultation that I will go over what your needs are and help you determine what coverage is best for you. One other quick tip, not everyone in the family has to be on the same insurance. Why is that important? Because if you have one person in your family that maybe isn't as healthy as everybody else, why would you pay jacked up rates for everyone that's healthy for the person that needs some special treatment, whether they need a certain medication or have some chronic issues they're dealing with? You don't want the whole family, your family budget being blown because you've got one person that has some different needs than yours. So it's just something I do when I consult with everyone, is figure out what your needs are, what makes sense. I have an array of options of different things you can get. If you don't use me, make sure you use a broker that has access to multiple carriers, because if not, you may not be getting the best deal or the right coverage for you. There's too many insurance agents that try to fit a square peg in a round hole. It doesn't work because that's their product and they want you to be on their product, whether it's the best product for you or not. So you've got to have someone that can search different options for you, give you some advice, and help educate you and be a resource for you when you do have something happen. Or, you know, it's okay if you want to have one big name company, and feel free to call those 800 numbers and see what good luck you have with them. So that's my education for this week. I'm very passionate about this, about educating people, because I know that we can help affect change. It's not going to be overnight, but we can do it. If people will just start educating themselves and asking for pricing and doing the things I know that you can do to help manage your costs, you'll be amazed at what you'll save. So until next time, see you then. Again, hop over to my webpage, jcapconsulting.com, or my Facebook group, JCAP Consulting. Talk to you soon.